How do copays and deductibles work in Medicare Part C plans? In today's healthcare landscape, understanding Medicare options is more important than ever. With recent discussions surrounding Medicare Part C, also known as Medicare Advantage, many are asking how copays and deductibles work in these plans. If you are considering your Medicare choices or looking for ways to manage costs, you are in the right place. Medicare Part C plans are offered by private insurance companies approved by Medicare. They must cover everything original Medicare covers, except hospice care, which remains under Part A. However, these plans often come with different cost structures that include copayments and deductibles. Let's break it down. Some Medicare Advantage plans have a deductible. This is the amount you pay out of pocket before your plan starts covering services. The deductible can vary by plan and may apply to different types of care, such as hospital stays or outpatient services. Once you meet the deductible, you typically pay a fixed copayment for specific services. These services can include doctor visits, specialist appointments, or prescription drugs. The copayment amount will depend on your specific plan and the type of service you receive. In addition to copayments, some plans might requiring coinsurance. This means you pay a percentage of the cost of a service after meeting the deductible. This structure can affect how much you end up paying for various health care services. It is also important to note that Medicare Advantage plans may requiring you to use a network of providers. This means you might pay different amounts for services depending on whether you go to an in-network or out-of-network provider. For example, for blood tests, you may face copayments or coinsurance and may need to use specific in-network labs. Another key feature of Medicare Part C plans is the annual out-of-pocket maximum. This limit caps how much you will pay for covered services in a year. Once you reach this limit, the plan will cover 100% of covered services for the remainder of the year. Because Medicare Advantage plans vary widely in their cost-sharing structures, it is essential to review each plan's details. This includes understanding deductibles, copayments, coinsurance, and provider networks. Some plans might also offer extra benefits, such as hearing exams or coverage for hearing aids, which are not covered by original Medicare. In summary, copays and deductibles in Medicare Part C plans function similarly to other insurance plans. You may pay a deductible first, followed by copayments or coinsurance for services, with a cap on your total out-of-pocket spending annually. The specific amounts and rules will depend on the Medicare Advantage plan you choose.